Oscar. I'm a student physical therapist assistant here at IoT, and today we're going to be going over IFC on this machine here. So if you come on closer, first things first, you're going to plug it in, right? And then you're going to go ahead and back here, you're going to flip the switch, and it's going to take a moment to turn on. And then that's the contrast. Give it a few seconds, turn on. Cool. So this menu setting is going to pop up. You're going to go into electrotherapy, and then this is going to pop off, right? We're going to go into interferential, which is IFC. You're going to click that, and then this screen will also come up. We're going to go ahead and hit edit. Right. Once we hit edit, this screen also comes on, explaining the parameters. And right now, it's currently set for gate control theory, which is 80 to 150 and then 4,000 megahertz, right? And this can also go into 5,000, which would be considered a nerve block, and then 2,500, which would be considered the opioid release. So we're going to go ahead and turn the vector scan on, and you can change it to 40%, which would be for chronic edema, and 100%, which would be more acute edema. And then manual would be for anything else. And then sweep is going to stay on. If it stays off, it stays at a constant frequency. We don't want that, right? We want it to stay on. And since we are doing opioid, we're going to go ahead and adjust this. So the lowest it'll go is going to be a 2. And then the other one, the highest it'll go, is going to be a 10. So we're going to go all the way down into the 10. Right there. We'll go back. Cool. And then the other thing that will change is this, just so the milliamps would appear. And that would be considered for the intensity of the treatment. Right? The treatment time can stay at 20 minutes for now, since I'm just going to show you guys on how to place it. So once we are placing it, I'm going to go ahead and use myself as an example. We're going to have some electrodes here, place them. First things first, actually. I'm going to go ahead and connect these wires. I'm going to connect these on the bottom here. There we go. That's one. Here. Cool. That's 2. All right. And then the electrodes. And then Andrea, would you mind helping me place these real quick? So we have a guest, surprise guest. We're gonna place these in a crisscross. We're gonna put one here, and then the other one here. And you want it to be in the center area of pain. So for example, we're gonna put the elbow as the area of pain, and then it's over here. Cool. All right. Thank you, Andrea. Before you leave, one more thing. All right, so we're gonna grab this, and we're gonna make sure it crisscrosses. We're gonna place one here on the top. And then the other one's gonna go on the opposite end. There. Last one. Thank you. All right, so if we go back onto the screen, we're going to switch the little dial here for start, just so it kind of starts the machine. Okay, and then now there we're going to adjust the intensity or the amplitude. Right, and as you can see on the screen, it's starting to rise. And then as that's starting to rise, you're going to send electrical signals into the electrodes, which would stimulate the opioid release into the body. Now I'm starting to feel like a tingling sensation in my arm, and there's some twitching. Right, nice. So this would be a good treatment plan for pain reduction because it would last between 24 to 48 hours afterwards. And when a patient leaves, they would feel that tingling sensation, or they may feel that tingling sensation at their house. So for 48 hours, right? And then the amplitude is also dependent on the patient as well. They're just gonna want to feel that twitch and that almost staticky sensation in the area. Just like that. Awesome. All right. So with that being said, I'm gonna go ahead and stop the treatment. Just like so. And then turn this off. Now we're good to go.